A number of principles underpin case management best practice.
And the main principles are setting goals for the client, a person-centred care approach, assessment of the client, setting the goals, evaluating, monitoring and reviewing the goals. And without doing that, you can't really see whether you're achieving or whether the client's achieving what they set out to achieve. The underlying principles are around ethics and professionalism and legal issues and abiding by the organisation's own policies as well that you work for, as well as government guidelines.
Placing the client at the centre of care is fundamental.
Case management needs to be a single point of contact, needs to be sustainable, needs to be client-focused, and that also means that we need to respect the client's decision. We need to focus on the client's wishes and not on what the case manager thinks is good for the client, but what the client actually identifies as they see important for their own life.
Case managers often look after multiple clients. While the principles of case management are the same, the needs of clients vary enormously. Those needs always come first. Case managers have to be flexible, adaptable, and able to work creatively.
It's important to be innovative around that and to show creativity, because otherwise we just get stuck in the same approach for the same client. But everybody is different, every client is an individual, and every individual has their own individualised problems and issues and wishes that we as case managers need to respect and need to work with.
Many clients are vulnerable and often not in a position where they can ensure their rights are upheld. In many instances, a case manager might be the only person who can ensure this.
Some of the principles are around the personal development of clients and advocating for client rights to ensure that their rights are upheld. That's a really strong role of the case managers in sometimes really difficult circumstances.
Working with client strengths is a critical principle of case management.
That we don't set goals that the client never achieves, and that we work with the client's strengths towards achieving the goals that are achievable. And that we build on these strengths and not focus on what the client can't do, but that we focus on what the client can do.
Case managers must be committed to ensuring a care plan is appropriate for the client and that it always works towards achieving client goals.
It's also ensuring that the care plan and the strategies and everything is purposeful, that there is a valid reason behind everything that's being done, and that it's sustainable, particularly if it's long-term case management.
In some instances, the care plan should also contain agreed criteria for disengagement or a reduction in case management if and when goals are met. Around the world, case management associations play an important role in establishing principles and maintaining professional standards. The Case Management Society of Australia is an example. In the USA, there are two main bodies, the Case Management Society of America and the American Case Management Association. Canada has the National Case Management Network, and in the UK, it's the Case Management Society of the United Kingdom.